Welcome back to Street Level Marketing with your host, Mark Lamplugh. We're talking about call centers here with Samuel Epstein. This segment, I want to kind of get into the marketing aspect, the fun stuff, where we're building campaigns to start driving up calls, and then you have the call center that their job is to convert those campaigns. Sam, what marketing channels have delivered the best ROI in the behavioral health space that you've seen?
Yeah, I mean the main three, paid search,
Mhm.
pay per click, second, search engine optimization SEO, and then third would be social media marketing as well. I mean, if you can really tap into the social media, that's definitely going to be the probably the most advantageous route of going. It takes a very specific type of not only person, identity, voice, and brand to really get into that, but that's one that's growing rapidly,
Yeah.
as social media marketing in general grows rapidly, but specifically in behavioral healthcare, I see that more and more.
Yeah, the social media, it's especially in the healthcare, behavioral health, mental health, it's tricky to get it right. But if you can get it right, it can be very lucrative as far as generating calls. How do you align the call center messaging with the ad campaigns?
Yeah, I think really what we're trying to do there is use use as close to exact language as possible, of the brand, of our agents, identifying pain points. I think that's really important. Um, it has to make it so that handoff from the ad is seamless. We don't want them coming in thinking they're getting this, but then it's that. So in any way we can adopt a more seamless handoff, um, you know, we're going to try to make the voice of that content align with that.
Yeah. Yeah, and it's one thing that's unique in the mental and behavioral health space is some of the rules and regulations that go into creating Google PPC campaigns. And now Facebook has, you have to be legit script certified. Google, you can't run them now unless you're legit script certified. So that's another pretty much like a unique aspect to the healthcare or behavioral health space. That is something you really got to think about, when you're launching these campaigns. And I know you're on the operational end of this, but what is your approach to launching and testing the PPC campaigns?
Yeah. So when we're launching and testing, we, first want to do like pre-launch briefings. We
Mm.
want to make sure that uh, it is a seamless handoff, like I spoke about before. So any kind of pre-launch briefing that we can have amongst our team, um, that kind of gives us an idea once it is launched, you know, are we seeing the effectiveness through the conversations, right? Like, we can kind of gauge our more or less script, based on the response, so making sure that our team is ready, suited up, can provide direct feedback as soon as possible. That way we can make quick adjustments as needed.
Right. How do you track a lead or a caller from the click to the conversion inside the call center?
Yeah, so we use dedicated tracking numbers. We connected our CRM through call tracking metrics, and it's usually the route that I recommend. It's a very easy tracking platform. So through call tracking metrics, we can see exactly where the numbers coming in from. And of course, that's going to help us, pivot or hit the gas on the marketing efforts.
This is, I'm thinking about this when we were, rolling out the call center that we had. And I think we were probably one of the only ones that hired a third party vendor to answer calls on off hours. And they fired us after 2 weeks because there was too many calls coming in. So how do you build a call center readiness, when you're launching a campaign?
Yeah, I think rehearsal, right? I think that's really important. I think, like I said, from one company to another, it's not. It is the same, right? We're definitely selling the same process, but it is very entity specific. So I like the rehearsal method, right? Let's get them in there. Let's go over some different scenarios, especially when we know we're having more targeted marketing efforts. We have an idea of what we're going to bring in. We know where it's going to be, loved ones versus direct patients, or this age versus that age. So it's very easy to rehearse, and I've seen that be the most effective.
Yeah, and there's also the third aspect in the call centers for behavioral mental health, and that's referrals.
Mm.
And that's also a big process on creating successful campaigns, is utilizing those referrals to help drive in new admissions. Because it is really hard to target a particular person's insurance. When you're creating these campaigns, whether they're going to be an insurance that you can take at your center, or it's going to work for a facility you have a good relationship with, that has another good program that works with that insurance. So that's unique into, I think, this space and other healthcare than generalized call centers. What makes a great landing page from a call center perspective?
Yeah, it's a great question. I think clarity is probably number one. It needs to be clear on the message, of what you're providing, and what that looks like in regards to how to contact, right? There needs to be a very strong CTA, call to action. Also the emotional resonance, does it attract them emotionally? Does the CTA invoke some emotion to them that's going to give them a sense of urgency to pick up the phone and call? And when you're doing this, you want to do this with minimal distractions. We want to make sure that, yes, we want to, make it attractive. We want, depending on, what level of care, what type of facility, the different level of attractiveness, but we definitely don't want to miss out on this sense of urgency, which is going to be, really that strong call to action.
Mhm.
So maybe some pictures, minimal pictures, but to highlight some of the more important things that your specific demographic are looking for. So if you're more trying to attract more like a clinical driven, like a mental health space, or more of just like comfort on more of an inpatient level, we'll have that, but with doing that with minimal distractions.
Yeah. Another thing too, I think on the landing page front, and this is something that happens, I think, in every behavioral mental health call center across the country, is making sure what you offer at your facility is clear on the landing pages, is clear with the call center reps, because how many times after somebody admits into the program do they say, oh, well, they told me this was going to happen, or this, it was 5 days a week instead of 4, or I had my own private room, and we were allowed to have our cell phones. So, making sure we're on top of that.
Yeah.
How do you respond when PPC leads aren't converting by phone?
Yeah, there's a few different ways. I mean, definitely want to see the source quality.
Mhm.
Is it aligning with the quality that we're going after? Going back to listening to calls, I think that's a pretty big one as well. We want to make sure that our reps are handling them properly. And then from there, revising any necessary scripts or talk points as needed. But sometimes it's a funnel issue.
Mhm.
It's not a phone issue. It's more of a funnel issue, and we kind of need to go in there and redirect those efforts. So I think just identifying which one it is first, and then taking action based on that.
Yeah. What type of KPIs are you monitoring daily?
Yeah, so there's quite a bit of different KPIs we're monitoring, but we want to ensure talk times are down, right? We want to make sure that we're sitting at a good number of time on the phone. Too much time can be a little bit much, especially for the substance abuse patients. If someone's struggling, they don't want to stay on the phone. They really want to get this thing done. Whether it's the assessment or building rapport part of the admissions process, they want to get in and off the phone. So measuring talk times, also conversion rate specifically. How many people did we talk to, and how many actually converted within the conversion rate? How many were good to go, meaning that they were qualified. Whether good to go meaning for the facility specifically, or referrals out. That list goes on and on. There's a lot of KPIs that need to be measured on a daily basis with a call center, not even just behavioral healthcare specifically, but just call centers in general. Those two will kind of give you a good idea of the effectiveness of the reps. Everything else is just a matter of just slight adjustments.
Yeah. Well, when we come back after the break, I want to get into the retention of the calls, the referrals that we talked about that are specific in the mental and behavioral health space, and the relationships. That's one of the key aspects. I think many forget and don't spend enough time kind of molding. They want those hot calls right away. They don't want to work the back end, and it typically folds you sometimes. So when we come back after a word from our sponsors, let's get into talking about that.
Sounds good.